Hi there. Good afternoon and welcome to How's Your Relationship with Food? This is part of our monthly Lunch and Learn webinar series. My name is Bridget Downey and I am the Programs and Events Manager with the Mental Health Association. We are pleased to be joined by Michelle Kelley. She is licensed clinical social worker and owner of Women's Counseling Center. And she is going to give us a presentation on eating disorders and how we can have better relationships with food, manage stress, and all the contributing factors that lead up to the eating disorders. There has been a 40% increase in eating disorders nationwide, and we are seeing more of that in our area as well. So this is Eating Disorder Awareness Week, and so we were pleased to offer this to raise awareness, and we're pleased to be joined with Michelle, and I will turn it over to you, Michelle, now. Thank you.
Thank you, Bridget. So yes, we're going to be talking about relationship with food, eating disorders, as well as disordered eating. We normally don't think about having a relationship with food, but we all do. And on one end, you have a healthy spectrum, and the other end is where you're going to find the disordered eating and the eating disorders. All right, so today I'm going to take you through different aspects of eating disorders, as well as we're going to talk about disordered eating. I want you to know that if you're struggling or someone you care about or a child is struggling, that you're not alone. Eating disorders are becoming increasingly more common, especially since COVID. We've seen an uptick in eating disorders since then. I want you to not be subject to some of the myths and the misconceptions around eating disorders, and we'll get into that a little bit later. I want you to feel hopeful about some of the research that's out there in terms of treatment and recovery. And I want you to know what you can do as parents if you have a child that is struggling. All right, so as I had mentioned, eating disorders are becoming more prevalent, more so than people realize. And they affect people of all ages, genders, races, and socioeconomic classes. So they don't discriminate. And they are often found with issues such as depression, anxiety, obsessive compulsive disorder, self-harm, and even suicidal thoughts. So we call these co-occurring issues. So they don't travel alone. By nature, eating disorders are isolating, and not just for the individual who's struggling, but for families as well. And that's because they are associated with high levels of guilt and shame. And these emotions in particular are incredibly paralyzing. So that makes it really difficult to talk about. All right, so let's take a look at some of the different types of eating disorders. The one that most people are probably most familiar with is anorexia, and anorexia is characterized by severely restricting food intake, which leads to dangerously low body weight. It often involves body dysmorphia, and body dysmorphia is when you have a distorted view of your body. For instance, someone may see themselves as severely overweight or even obese, when in fact they are of a normal body weight, or they might be hyper-focused on perceived flaws. Anorexia can be fatal, so it is the most serious of the eating disorders, and it often requires some type of residential or medical treatment. All right, so bulimia. Bulimia is characterized by episodes of binge eating disorder, followed by some type of purging. So the purging could be throwing up, it could be using laxatives, it could even be over-exercising. People with bulimia tend to present with a normal body weight. So you can't look at someone necessarily and know if they are struggling with an eating disorder. But with bulimia, there's always going to be a feel of a loss of a sense of control. All right, so binge eating disorder is the latest one to kind of join the family of eating disorders, and it's characterized by recurrent binge eating episodes, not followed by purging. So these individuals also present with a normal body weight, But also there's a feeling of being out of control, and often there's shame involved as well. Orthorexia is an interesting one, and we're definitely seeing an uptick of those with orthorexia and mental health, and it is an unhealthy obsession with healthy eating. And as we all know, there's a movement, a large movement in our society to eat healthy, to have clean eating, but taken to an extreme, it can lead to anorexia, and it can obviously become very problematic, and it can start out in a very innocent sort of way. So, all right. And this last one is probably one of the more unusual, rare ones, and it's avoidant restrictive food intake disorder. And with this one, this eating disorder, people tend to present as picky eaters, and maybe they just have a lack of interest in the food, or they're just avoiding it. And it can often lead to just low food intake and possible health issues. And it's important to note with all of these, there are going to be there's an emotional impact as well as a physical and a medical one. Like with bulimia, you can have severe damage to the esophagus and the digestive system, dental issues. With anorexia, you can have organ failure. So each one of these is a little bit different. And body image issues are often involved with these eating disorders, with the exception of the avoidant restrictive food intake disorder.
Michelle, I had a quick question about anorexia.
Go ahead.
With anorexia, is it true that it can cause heart issues as well?
Absolutely. So and that's one of the main complications is I'm not a medical professional, but it can cause irregular heartbeat. It's just going to have a serious impact on the heart as well as other organs. So it's really important with anorexia that a medical professional is involved, right? So when we look at the team approach, you're going to need a therapist, and especially with anorexia, you're going to want someone to be followed by their pediatrician or their primary care doctor, because obviously when you're talking about the heart, that's really serious. So yes.
Great, thank you.
All right. So what's it like to have an eating disorder? Actually, it's awful. The mind becomes constantly occupied with thoughts around eating, what you have, what you ate, what you're going to be eating. It overshadows everything else. It becomes the primary relationship, and it's exhausting, and it's all done privately. So you can't look at someone and know, right, if they have a mental health struggle. You can't look at someone who's struggling with an eating disorder and know what it's like to kind of be in their mind, but they're likely feeling trapped and they're feeling isolated, and it's exhausting. It takes a huge mental toll on someone. So that's kind of what's going on behind the scenes emotionally with someone with an eating disorder. So here's a list of some of the warning signs. There are more, and certainly if a person has one or several of these, it doesn't necessarily constitute an eating disorder. But here's some things to watch for. Having a preoccupation with a person's weight, with their body image. Maybe you're noticing a child just making more comments or kind of comparing their body to someone else, or maybe you notice that they're starting to weigh themselves or pay attention to how they look in their clothes. You might see a disruption in their eating patterns. Maybe they used to always love to eat breakfast and they're skipping meals now. You might notice that preoccupation with nutritional content, and they're wanting to kind of read labels more. Changes in exercise patterns, right? Exercise is good, but exercise taken to an extreme can be a warning sign that there is something else going on there. So, but with exercise too, with people with eating disorders, they tend to get really clever with hiding some of their behaviors, and exercise is something that somebody can do behind closed doors. Mood fluctuations, I know that's a really difficult one because lots of adolescents have mood fluctuations. Doesn't mean they have an eating disorder, but if you have an eating disorder, you're going to be on an emotional roller coaster ride. The last one, use of laxatives, diuretics, and diet pills. Oftentimes you don't know when someone, especially an adolescent, is misusing that. So that tends to be more secretive behavior. All right, so disordered eating is often what precedes an eating disorder. So it's a range of irregular eating behaviors, which may or may not constitute an eating disorder, but it still needs to be taken very seriously, right? Because it can just be shy of meeting the criteria for an eating disorder. So some examples of disordered eating would be fad dieting, yo-yo dieting, just a general preoccupation with food. You might notice, again, inflexible eating patterns. People want to eat certain times of the day, or maybe they're taking intermittent fasting to an extreme and they're trying to eat everything within a 2-hour window, or they don't want, they're trying to eliminate a food group such as all fats or all carbs, and we know that can be unhealthy. All right, the laxative abuse, you're probably not going to notice because an individual with an eating disorder is likely going to be hiding that. All right, and disordered eating is also on the rise. And I mean, this is nothing new. It's been around for a long time. And when we talk about a healthy relationship with food, we have to kind of look at disordered eating, because a lot of people have engaged in disordered eating and maybe not necessarily had it developed into an eating disorder, but it can still be problematic. It can still be very time consuming emotionally when you're trying to manage your food and emotions around food. And this is not something that our society has been good at talking about. And we're starting to more and more. So that's definitely a good thing. All right. So some of the myths and the misconceptions around eating disorders are that they only affect girls and women. Well, as I said earlier, they impact people of all ages, races, genders, and socioeconomic classes. So it's not just a girl thing or a woman thing. Guys, men also struggle as well, right? And it affects the entire age range, right? But I will say that onset typically happens in adolescence or young adulthood. And the onset of an eating disorder usually will come about as a result of maybe a stressful life situation or transition period, like going into middle school or high school or college, or having something traumatic happen in the family. All right, so eating disorders are not easy to detect. You cannot look at someone and judge them by their body size or shape. You can't necessarily just look at how they eat and determine if there's a problem or if they might have an eating disorder. So the eating disorders are a choice. This is a huge myth. It is not a choice. Nobody wants to have an eating disorder. They're struggling. I mean, it becomes your primary relationship. It's a serious mental health issue, illness. So it's certainly not a choice because nobody would choose it. And they can be serious. So eating disorders are not that serious. False. That's the myth. Anorexia can be fatal, and it leads to medical, residential hospitalization, and an individual needs to be followed by a medical doctor. And even if we're not talking about anorexia, some of the other eating disorders can have a long-term physical as well as emotional impact on a person. So the last myth is eating disorders are caused by media hype or the result of dysfunctional families. That used to be the way people thought many years ago, like kind of throw the family under the bus or blame everything on the mom. Well, there's no research to prove that. That's absolutely not true. There are plenty of people that struggle with an eating disorder, and they come from high functioning, healthy, loving families, right? And it's not true to say that social media has caused it. There is no one cause, right, for anything in mental health or an eating disorder. I will say that social media has played a part and has an impact on someone starting with disordered eating or developing an eating disorder, because there's a lot of comparing that goes on with social media. I mean, it's hard not to compare when you're looking at somebody's best pictures that they're putting out there. So I think that's kind of human nature. All right. So some of the latest research is showing that there is a genetic predisposition. It is not uncommon to find that eating disorders will run in families. And so it's not a lifestyle choice. And there is a medical, biological reason sometimes for why these start. So there's continuing to be hopeful research on the neuroplasticity of the brain, which means a person can recover. There can be full recovery from an eating disorder. And the brain can change, and it does change, especially when you're talking about working with cognitive behavioral therapy, and you're addressing some of those underlying thoughts and beliefs that feed into an eating disorder. As an individual works to identify those distorted thoughts and change them, that actually does have an impact and will create brain changes. And another thing that we do when we're working with someone with an eating disorder is we want to help them calm their nervous system down. And one wonderful way to do that is with mindfulness training. And we're all hearing a lot more about mindfulness these days. And it's true that focusing on your breath and learning to observe your thoughts, your emotions, what's going on in your life is very empowering. It's calming to the nervous system. And anyone who has an eating disorder is also struggling with managing their emotions. And so that's why the therapy component is so important with an eating disorder, is because there's so much that goes on behind the scenes emotionally, with a person being triggered emotionally and then having a behavior triggered, whether it's binge eating or not eating or over exercising. So again, I think the most hopeful research is that full recovery is possible with treatment. All right. So as a parent, what are some of the things that you can do to help? Well, the first thing is stay calm. And that's probably one of the hardest things to do, because if you have a child that's struggling with any type of mental health issue, it's scary. You're naturally going to have an emotional reaction to that. So it's important as a parent to make sure that you have a support system or you have a therapist that you can talk to, because if you allow yourself to get very emotional, it's likely going to trigger your child to pull away or shut down. And they're probably already doing enough of that. So it is important when you have dialogue and interact with your child that you try and do that from a calm place, which is going to mean that you're going to need your own support. So when talking to your child or anyone, and you suspect there might be an eating disorder, it's really important to focus on what you're saying. What you should not be saying is making comments about their body or their weight, such as, seems like you've lost weight, or those clothes don't fit you anymore. You want to stay away from those kinds of comments. They're very triggering. But what you can say is, it seems like you don't want to join us, in eating dinner anymore. It seems like you don't want to go out to eat with your friends, and you used to really enjoy that. So you want to kind of highlight that, because really what you're doing is you're planting seeds. You're not saying there's an issue. You're just saying maybe there is and maybe there isn't. You could ask your child to meet with a professional. And if there's not a problem, there's not a problem. But that's a way of trying to bring an outside person in so that you're not dealing with this all by yourself. It's also important to create a community of support, not just for your child, again, but for you. So a lot of times parents are so focused on helping their child that they don't realize the importance of putting the oxygen mask on themselves so they can help their child. So oftentimes family counseling and support is a part of this process. All right, so here's some basic suggestions of things you can do as a parent to try and encourage a healthy relationship with food. It's important to pay attention to the dialogue that you have with other people around food, around body image, because as a parent, particularly as a mom, if you have some body image issues, your child's going to pick up on that, particularly your daughter's going to pick up on that. So you want to be careful about that. And realistically, I think many women, moms, are going to have some kind of, they're not going to have perfect dialogue. We don't have perfect thoughts. I mean, nobody loves their body. And that's not realistic. So I'm all for parents being very authentic when talking about their kids. And if you struggle, then be open about that. And if you think your child is struggling, and you can share that you've also struggled, and maybe both of you can kind of get some help and support. So, and you also want to role model what a healthy relationship with food looks like. And you can't do that if you don't have one. And if you don't have one, well, you're human, so it's okay. But again, it might be an invitation, an opportunity for you as a parent to also put some focus on this, because it might be an area of improvement for you as well. I remember one time I was frustrated with my daughter because she wasn't eating meals and she was grazing all the time. And she said to me, well, Mom, where do you think I learned this from? And so I should have seen that coming. So then we had some good conversations around that, because I have a healthy enough relationship with food, but it's on a spectrum, and we're all going to be at different places on the spectrum of a healthy relationship with food. So it's important to expose your kids early to healthy, balanced eating, which does not mean that you remove a food group, right? Sweets and sugar and desserts are not bad, right? We've all heard that phrase, everything in moderation. So I think it's important to just role model for your kids just balanced eating, and also to help them pay attention to how food makes them feel, right? I had to learn that in my life. Like if I eat too much sugar, I don't feel good. So I think it's important to be mindful about that connection between the food. There's the food mood connection is real. So I've always enjoyed talking to my kids about that, to kind of create that mindfulness for them.
Michelle, I had a question. When should you bring in a dietitian? It says, add that to your support network. When should you bring that in?
Thank you, Debbie. I skipped over that one. Certainly, if your child is struggling with an eating disorder, that is the time. Or even if you suspect, I love adding a dietitian to kind of your support network, because a dietitian has so much valuable information to offer. I learned about health in 5th grade, about, the different food groups and and I don't remember that anymore. So, in my opinion, I am such an advocate of working with a dietitian that, as a therapist, I would say every teen should be having a couple sessions with a dietitian, but especially if someone is struggling with an eating disorder. I think it's a good idea, but you might want to also check with the child's doctor or the therapist. So we use a team approach when working with an eating disorder. And I tell parents, start wherever, right? It doesn't matter whether you start with your medical doctor or a therapist or a dietitian, because if there is an eating disorder going on, we're all going to come together and work together. So sometimes a family will come to me and I'll start working with them, and I will tell them that the way I work is using a team approach, and I'm going to refer them to a dietitian, and we're going to get their pediatrician or doctor involved so we all can work together. And I know sometimes people will reach out to a dietitian, and then the dietitian will reach out to a therapist to kind of start creating that team support. So did that answer your question? Or
Yes, thank you so much.
all right, so here's some resources, and I know there's a lot more out there. There's also a limited amount of eating disorder support in our community. There are a couple of therapists around. You can find them on Psychology Today who have more of a specialty, but there is the Eating Disorder Center, and they are located in Arlington, Virginia, and I think someplace in Maryland. And they're a wonderful support because they offer a lot of remote virtual support. And if they feel that your child needs a higher level of care, they're not going to do that. But it's a great place to start because they're going to do an assessment, and then they're going to be able to kind of point you in the right direction. It's always a good idea to contact your doctor or your child's pediatrician or a mental health professional that has some experience and knowledge working with eating disorders. So I am not an eating disorder specialist, but I've worked with girls and women for enough years to consider myself knowledgeable. And I know when I'm out of my field, and I know when it's time to refer out to a higher level of care. All right, there is the National Eating Disorder Association, and the number on your screen there. You can always call them for support and resources and parent support. They also have a website. I don't have it on there, but you could Google it. Sometimes it's just important to start wherever you can. Maybe you know somebody whose child struggled and you could ask them. Maybe you want to do your own research. If you start asking around, eventually you're going to, it's going to lead you to the right place. But make sure that if you have that concern, you definitely either want to start with a pediatrician, mental health professional, or dietitian. All right.
I have a question.
Yes.
Yes, so let's say that as a mother, you are concerned about eating disorder for your child, and would you reach out to the pediatrician and the centers before communicating with the child, or should you speak with the child, then reach out to the pediatrician or centers?
That's a really good question.
Mm-hmm.
So what you're going to be doing with a child is you're going to be planting seeds of concern, right? Without becoming kind of overly emotional. And then it's always a good idea to reach out to your child's pediatrician, because most kids know that they see a pediatrician regularly. So, but what you'd want to do is privately communicate with the pediatrician about your concerns, so that doctor can be screening the child and talking with you privately, because talking in front of them is probably going to be triggering. So, and I think it might be a little more alarming if you tell your child that you're going to bring them to a therapist because you're concerned they might have an eating disorder, unless they're open to it. And these days there are, more and more kids and adolescents are open to therapy and counseling. So there's just not one answer, but in general, if you feel like you can't talk to your child, he or she completely shuts down, then I would probably just talk to the professional especially a medical doctor. And then if you do reach out to a therapist, here's what you say to your child. Maybe I'm off base. Maybe there's nothing here, but let's just go and get it checked out. And let's just see what a professional thinks. So that's how you want to kind of lead your child kind of down that path. I mean, most children, adolescents don't like to be kind of blindsided. I've been on the receiving end of having a child come into my office and 15 minutes before they had no idea they were going to therapy. So I do like the idea of giving some information. It's really important how you present that information.
Thank you.
Michelle, thanks. Michelle, just as a follow-up question to that, you mentioned planting the seeds of concern. Do you have suggestions to parents on the best way to approach and handle that? Like, what are the best terms to use or something so that we don't send them off in an opposite direction, as moody as they are as teenagers?
Yeah, good question. I think you want to make comments around behavior changes, right? As I said earlier, you don't want to comment on their body, on their weight, but you do want to say, hey, it seems like maybe you're not enjoying your time with your friends as much, or you seem to be just pulling away, and we'd love to have you join us, and I'm not sure what's going on there. So, right, you just it's a kind of a gentle approach, but no matter what you say, when you're dealing with eating disorders, it may just shut your child down. So, I mean, these are some tips, but if your child does shut down when you bring it up, don't think you've done something wrong. This is truly a difficult thing to talk with kids about, but you want to come from a place of concern, and you want that to show through your tone of voice and with your words too. You can just say, hey, I'm your parent. I'm concerned. I mean, I think it's hard for kids not to feel genuine concern when it comes from a parent, but they still may shut down.
So what happens once you start treating someone who has an eating disorder? So I'm the mom and my daughter's coming to you, or my son's coming to you, and they're in therapy. What are some tools or tips to help the parents and other family members like navigate that system, like especially during the holidays when there's family gatherings and meals? And is there like a plan or a treatment type plan that families should follow, as well as do the families get involved in the counseling session on that end?
Absolutely. So family counseling is an important part of treatment when dealing with an eating disorder. So, and the therapist should kind of take the lead here. And this is a great question to bring to a therapist, to kind of ask, well, how do we handle meal times or family gatherings? And you want to kind of have this discussion with your child, with the therapist, to kind of talk out what their triggers are, because anyone dealing with an eating disorder has triggers and they have fear foods, and this needs to be talked about and addressed. And you just want to kind of open up the conversation. That communication is so important. And oftentimes, right, at family gatherings, there are people that are well-meaning and they just make inappropriate comments that can be very triggering. So I think it's really important that the child or the parent knows how to handle those comments when, Uncle Ed, comments on how much your child is eating or a change in their weight. You need to be able to know how you respond to that. Like, you can say to someone, hey, this is a weight-free kind of talk zone. Like, we don't talk about weight and body images here. I don't think most people are used to saying something like that, much less hearing it, but it's a nice kind of empowering way to kind of shut down that kind of communication. So those are the things you would talk about when you're working with a family, because it's important to talk about those things. And so the family may or may not be involved in the more therapeutic aspect when we're talking about cognitive behavioral therapy, dealing with body dysmorphia, identified distorted thinking. That's usually more done one-on-one with a therapist, but the family component is very important because the whole family is being impacted when your child has an eating disorder. So that's important.
Thank you.
Any others? We're done?
Well, you mentioned, if you don't mind, you mentioned triggers and something fear food. What's fear food and what's that all about?
So most individuals who are struggling with an eating disorder can identify several types of fear foods. So these are foods that are triggering to them, that they're almost literally afraid to eat because they have some type of distorted thinking that says if they eat this food, they'll gain 10 pounds, or it's incredibly unhealthy. So an example of a fear food, or it could be a group of foods. So a common fear category would be carbs. Some people want to just eliminate that food group altogether. Dairy is another common one, right? And this kind of connects a little bit with the orthorexia, which is the unhealthy obsession with healthy eating. And there's a lot of kind of fads out there about, going gluten-free, going dairy-free. And so a lot of individuals have decided that those are bad and they want to kind of remove them. And they develop a real fear around eating things with dairy or eating ice cream, or maybe it's meats, and maybe they've gone vegan and taken it to an extreme, and that's led to an eating disorder. So anyone with an eating disorder knows about fear foods, but if you're not, that's probably maybe a rather new concept to you. But it's a real thing. It's easy for a parent or someone else to kind of think or say, well, just get over it. It's not that big of a deal. But this is a mental health illness, and it's a huge deal. And there's a huge emotional part of this that needs to be addressed, and that's what happens in therapy, kind of behind closed doors. They kind of identify their thoughts and emotions and fear foods. And we bring that, which has been kind of under the surface, more in the unconscious, to the conscious level, and talk about it.
Great. Thank you so much.
Yeah. And if anyone has any questions, feel free to reach out to me personally. I'm out there on the internet, but it's Michelle at Warrenton Women's Counseling Center. And if you have a question, if someone's struggling, and I can certainly help get some resources for you. So don't hesitate to reach out. All right. So I think we're done. So
Thank you.
all.
Thank you.
Wow. I'm going to stop the recording here.